But Governor Kaine, let me begin with you, because it appears that the Republicans, and a lot of Republicans I talk to, are saying that this is going to be a Pyrrhic victory for the Democrats, that what you have here on the health care bill is $400 billion in tax hikes, $400 billion in Medicare cuts, and that's going to spark a backlash that's going to haunt Democrats at the polls next year.
George, of course Republicans are saying that. They've been trying to block this all year. They've said that they want to beat health care reform as a way to break the president. But there's no denying that this was a historic passage last night on an issue that President Teddy Roosevelt, a Republican, started 100 years ago, that now is moving forward in all the committees and now with the House vote of historic importance. And what this bill does is it provides security for the 4/5 of Americans who have health insurance so that they can't get abused by really predatory insurance company practices. It provides a path to affordable coverage for uninsured Americans for the first time in the history of this country. And then it does significant work to start to break the unsustainable growth in health care costs that is breaking the bank for families and businesses. We think this was a big and historic win into the week in a great way.
When you hear Governor Kaine talk about it, it sounds pretty good, but only one Republican voted for it.
No, look, you know, Teddy Roosevelt probably didn't have this in mind, and certainly this would have been one of those things he would have hunted on the big range and shot dead.
Teddy wouldn't have wanted insurance companies to be running things, I'll tell you that.
And the reality of it is, we don't want the government running things either. And so, and that's what this amounts to. This is a government takeover of our health care system. It is unnecessary. Republicans have not tried to block this for the purposes of saying no to health care reform. We've been trying to block it to bring some common sense and so we could sit down and have a discussion. Republican leaders, in a letter to the president in April of this year, requested a sit down, face-to-face, let's talk about your agenda and ours and where we can find consensus. They're still waiting for that meeting. They've been blocked from putting, I think, real reform into this bill. All their amendments were rejected in committee. They didn't have the chance to really debate this last night. You're doing this at 11 o'clock on a Saturday night. Americans watching.
Yeah, I mean, George, the debate stretched on. The debate stretched on for months. The Republicans had plenty of advance notice. This isn't a government takeover of health care.
It's very much a government takeover, Governor.
It is an effort by the Republicans to just basically shill for the insurance companies.
Oh, please. I mean, you know
the issue. No, just the issue in this bill that is so important to most Americans is that you're not going to get your policy pulled out from under you when you get sick, and when you change jobs, which a lot of Americans do 7 or 8 times in life, you won't get turned down for a pre-existing condition.
That's not until 2013.
But when the Republicans put their own plan, just hold on. When the Republicans put their own plan on the table this week, they didn't tackle pre-existing conditions. We're starting right away to deal with the pre-existing
conditions. Where's your tort reform? Where's your portability? Where's your small business pools? Where's your program for health savings accounts? Where are the various programs that you don't need 2,000 pages to get done? You don't need to overhaul the entire system the way the Democrats have put forth.
But Mr. Steele, you concerned, now you've got the stimulus bill earlier this year, no Republican votes in the House, 3 in the Senate, 1 Republican vote in the House here, that to a lot of people who are hurting right now, that this is going to seem like the party of the Republican Party is the party.
Look, I appreciate that perspective, and that's the image that the Democratic Party would like to have us see. But the reality of it is, and I go back to this point, that Leader Boehner and Leader McConnell both have had opportunities to put bills out there, to make amendments, all of which have been rejected. So the reality of it is, now we've got an opportunity to compare and contrast their bill to our alternative. The reality still remains. The reality still remains that at the end of the day, this thing grows the size of government. It inserts the government between the doctor and the patient. It now requires mandates on states that they can't afford, and it cuts $500 billion from a Medicare program that everyone in this country knows is on the road to bankruptcy. And the final point is, all of this is prepaid by taxpayers today for a program that they won't even begin to access for 4 years. Now, let me ask you
George,
this.
I've got to cut it in now.
No, let me cut one last point here.
Then you can ask the question.
Let me ask you this. Right. Would you buy a car today, put the money on the table today, and take delivery 4 years from now? Because that's exactly what you're doing with this health care system.
Great car.
I'm going to let
car.
Michael be the used car salesman. I'm going to talk about health reform,
well,
which is what
the
overwhelming majority of Americans want to see this. And what the Republicans are doing, party of no on the stimulus. They were letting the economy go into a free fall, not willing to do a single thing about it, losing 800,000 jobs a month, GDP down by 6.5% at the end of the Bush administration. They stood back. They were going to let it collapse. Thank goodness the Democrats and the president put a Recovery Act in place that has GDP growing again. Party of no on health care. Only
look,
one vote.
I'm not going to
done.
sit here and
only
go through
one
this
vote.
part. I'm not going to let you
only
go.
One
no,
vote.
sorry, Governor.
90% of them voted against equal pay for women. 90% of them voted against expanding health insurance for youngsters in the S-chip reauthorization.
You can check off the talking
These
points.
guys are getting excellent
I've
at the
heard
no
from
game.
both of you on this issue. I do want to move on to the elections because Michael Steele had a bit of a Freudian slip there. It said Speaker Boehner. Maybe he was looking out of the election returns on Tuesday, forecasting it into next year.
Where we won 2 House seats on Tuesday, George?
2 House seats on Tuesday. The
5 of 5.
margin of victory last night.
Yep.
But let me